Good evening and welcome to AFRIMEDIA Rwanda. Tonight, we delve into a devastating humanitarian crisis unfolding in Gaza as a new report by Human Rights Watch reveals the severe and life-threatening impact of Israel's war on pregnant women and girls in the region. Over 15 months of relentless bombardment and siege, medical facilities and healthcare workers have been decimated, leaving expectant mothers and newborns in perilous conditions. The harrowing findings expose increased risks of miscarriages, preterm births, and fatalities among infants, amid accusations of unlawful blockades and targeted attacks. Stay with us as we unpack the full scope of these allegations, the human stories behind the statistics, and the urgent calls for action from international advocacy groups. CNN was RITI. Israel's war inflicted life-threatening danger on pregnant women and girls in Gaza, Human Rights Watch says. CNN was RITI. Israel has inflicted serious and sometimes life-threatening danger on pregnant and postpartum women and girls in Gaza, over 15 months of bombardment and siege, according to a new Human Rights Watch report. The 50-page report, 5 babies in one incubator. Violations of Pregnant Women's Rights Amid Israel's Assault on Gaza, was published by the U.S.-based advocacy group on Tuesday. It details attacks on medical facilities and healthcare workers in Gaza that directly harmed women and girls during pregnancy, childbirth, and the postpartum period, and says the war has increased the risk of miscarriage, preterm birth, stillbirth, postpartum hemorrhage, and underweight newborns. HRW accused Israel of enforcing an unlawful blockade, a near-total ban on water, food, and electricity, starvation as a method of war, attacks on the medical system, and repeated forcible transfer, violating the right to follow-up and postnatal care for pregnant women and girls and their children. See mass return of displaced Palestinians to Israel is obligated to use all the resources at its disposal to ensure that everyone in Gaza, including pregnant women and girls and their children, are able to enjoy their human right to health, the report said. This includes ensuring the full restoration of Gaza's healthcare system so that all patients, including pregnant women and babies, have access to quality medical care. HRW repeated allegations that Israel is committing genocide against Palestinians in Gaza, which Israel strongly denies. Israel has also been taken to the UN's top court, the International Court of Justice, on allegations of genocide. CNN has reached out to the Israeli military and COGAT, the Israeli aid agency, for comment. Responding to a question about Israeli attacks on medical facilities and healthcare workers in Gaza, the Israel Defense Forces, IDF, repeated allegations that Hamas uses hospitals for its military operations. Hamas denies using hospitals as cover. CNN cannot independently verify either claim. Israel's onslaught since the Hamas-led October 7th attacks has wiped out entire families, decimated the medical system and supplies, spawning starvation, disease, and displacement. At least 47,306 Palestinians have been killed in Gaza, according to the Ministry of Health there. Of those, 12,316 were women, and another 808 were babies under aged 1, Gaza's government media office, GMO, reported on January 24th. Although a fragile ceasefire began last week, the survival challenges facing new and expecting mothers in the enclave remains dire. Babies dying in front of us. More than 1,054 health workers and medical professionals have been killed, including at least 6 pediatricians and 5 obstetrician-gynecologists, HRW said, citing the health ministry in Gaza. As of January, emergency obstetric and newborn care is available at 7 out of 18 partially functioning hospitals in Gaza, 4 out of 11 field hospitals, and 1 community health center, according to HRW. The rate of miscarriage in Gaza has increased by 300% since October 7, 2023, the International Planned Parenthood Federation said in July. 2 Palestinian women told HRW their fetuses died after they were injured by explosive weapons attacks that also killed their partners. Even for those who make it to a medical facility, hospitals offer little respite. Women can be rushed out within hours of childbirth because staff are overwhelmed by scores of patients injured by bombardment, according to HRW. Maya Sufyan Musa, 25, told CNN that when she journeyed on foot to Al Emirati Hospital in Rafah to give birth to her daughter Maria on February 27th, she was startled by crowds of desperate Palestinians seeking refuge. I did not get complete and sufficient privacy during my birth. I was very afraid of bleeding, said Musa. I faced great difficulty in giving birth due to fear of the shelling next to the hospital. My husband was informed that I had to leave immediately. It was a very difficult moment, and the cleanliness in the hospital was non-existent. For pregnant women in Gaza, the stress of trying to survive attacks coupled with food and water shortages could weaken the immune system, harm the fetus, and lead to preterm birth, HRW said. Dr. Adnan Radi, a medic at Al-Auda Hospital in northern Gaza, told the agency that most of the babies delivered by staff have severely low birth weight and are dying of perinatal asphyxia. We try to intubate the babies. Sometimes it has helped, but the picture is very gloomy, Dr. Radi said in the HRW report, adding that, in the last month I can remember more than 6 babies with low birth weight dying in front of me. Meanwhile, shortages of antibacterial materials can increase the risk of sepsis, pneumonia, and meningitis among newborns, Maram al-Sharafa, an aid worker for the NGO, Medical Aid for Palestinians, MAPE, in Gaza, told CNN. I started begging that God would take the baby. In sprawling displacement camps, parents say they cannot find enough food, clean water, warmth, or sanitation facilities. Instead, caregivers resort to feeding babies with infant formula made from dirty water, compounding the risk of dehydration, hepatitis A, and skin infections, according to HRW. Pregnant and breastfeeding women sharing toilets in crowded spaces are especially vulnerable to infections including UTIs, which can lead to preterm labor, low birth weight, and stillbirths, according to Al-Shurafa, a program officer for MAP. Women may feel uncomfortable or self-conscious breastfeeding in such conditions, said Al-Shurafa. This lack of privacy can lead to stress and anxiety, which in turn affects the mother's ability to relax and establish a successful breastfeeding routine. More than 48,000 pregnant women are experiencing emergency or catastrophic food insecurity, the UN's Reproductive Rights Agency said in December. At least 56 children have starved to death, according to Zahir al-Wahidi, the director of information systems at Gaza's health ministry. 8 infants and newborns have reportedly died from hypothermia, the UN's Children's Agency said in January. Musa, who is displaced in Deir al-Bala, central Gaza, told CNN that baby Maria is malnourished. The severity and ferocity of the suffering was concentrated in physical displacement, she said. I was afraid that we would be exposed to direct shelling or missile fragments, and from the rain and cold and the flooding of the tents. Isra Mazen Diab al-Ghul, 30, a pregnant woman displaced in Nusayrat, central Gaza, told HRW that in early 2024, she and her relatives had nothing to drink but seawater for 2 days. I vomited, and I was worried it would kill the baby. I started begging that God would take the baby, so I wouldn't need to give birth during this war. Communications disruptions impede women's access to hotlines and online information, while power cuts disrupt ultrasounds and blood and urine tests, HRW said. One prenatal care patient displaced in Khan Yunis, southern Gaza, told CNN she fainted by the time she arrived at Al-Auda Hospital because she was so exhausted by traveling on foot and lack of nutrition. She could not afford vitamins to alleviate her symptoms. Everything is scarce, said Rahaf Khaled, 21, who is 4 months pregnant. I want the war to end completely. I want to give birth to my child in good health, and I want us to return to our homes safely and soundly. CNN's Lauren Izzo contributed reporting. The story of RM, a 31-year-old pregnant woman from Gaza, highlights the severe hardships faced by Palestinian women amid Israel's military campaign following the October 7, 2023 Hamas-led attack. Struggling with famine, lack of medical care, and displacement, RM endured a high-risk pregnancy and delivery under dire conditions. Without adequate food, She lost weight and suffered from health complications, including untreated infections. During her painful labor, she lacked proper medical assistance, left the hospital just hours after giving birth, and faced additional struggles seeking transportation. Living in a tent after evacuating Rafah, her newborn developed life-threatening diarrhea. RM's ordeal reflects the widespread challenges for women in Gaza, where access to safe delivery facilities and postnatal care is severely limited. 5 babies in 1 incubator. Violations of pregnant women's rights. Amid Israel's assault on Gaza, 31, was 2 months pregnant when Israel began its military campaign in the Gaza Strip, following the Hamas-led attack on southern Israel on October 7, 2023. Her family struggled to find food. "I was literally starving," she told Human Rights Watch. "We were all in famine in northern Gaza. We had no gas to cook with. We had 1 meal a day to conserve firewood. Flour was very, very expensive. No food, no chicken, no meat. I lost a lot of weight." She also had health problems. "I already had low blood pressure and would faint a lot. I got lightheaded and dizzy. I had no energy, couldn't stand on my own." The family went to Rafah and visited a doctor in his private clinic for a checkup, but he could provide no examination beyond an ultrasound or give her any vitamins or calcium. RM suffered multiple urinary tract infections but did not go to a clinic because she had heard they had no medicine. The fighting complicated RM's difficult delivery on May 5th. "I went into labor at 2 a.m., she said. "I was in so much pain, and we were trying to find a way to reach the hospital." She said that at the hospital, she was not given any medication or an epidural. After she delivered, she had to change the pads she was wearing herself. "I went to the bathroom alone. It was terrible, very difficult," she said. "No one took care of me. Not a single nurse came to check up on me, monitor me, or ask how I was." RM left the hospital at 6 a.m., just over 4 hours after giving birth to a girl. "I was exhausted and couldn't walk," she said. "I was holding my newborn, and with my husband and 3 other children, we had to look for someone willing to drive us to my parents' home. It took hours until a car stopped for us. My husband told the driver we would give him anything if he drove us." A few days later, RM's family was forced to evacuate Rafah for Khan Yunis, where they have been living in a tent under harsh conditions. Her newborn daughter quickly developed diarrhea, which can be life-threatening. RM's difficult pregnancy and delivery reflect the extraordinary challenges faced by many Palestinian women and girls in the Gaza Strip since the beginning of the hostilities. Across Gaza, women have had limited access to safe places to give birth, even when they face a high-risk delivery. Since the hostilities started in Gaza, Israel has imposed an unlawful blockade of the territory, imposed several restrictions on humanitarian aid, and attacked medical facilities and personnel. In mid-January, Israeli authorities and Hamas agreed to a multi-phase ceasefire that includes the entry into Gaza of humanitarian aid, the return of Israeli hostages held in Gaza, and the release of Palestinian prisoners. As of January 2025, emergency obstetric and newborn care is only available at 7 out of 18 partially functioning hospitals across Gaza, 4 out of 11 field hospitals, and 1 community health center, compared to a total of 20 hospitals and other smaller healthcare facilities that functioned before October 7, 2023. The World Health Organization shared with Human Rights Watch an assessment of needs that identified 19 types of medical equipment and 24 types of medication for prenatal, delivery, and postnatal care that were in short supply and urgently needed as of December 2024. The quality of healthcare offered by the few remaining medical facilities and service providers is severely diminished. Women like RM are rushed out of sometimes packed hospitals within a few hours of childbirth to make room for other patients, many of them war casualties. All medical facilities operating in Gaza face unsanitary and overcrowded conditions and serious shortages of essential healthcare goods, including medicine and vaccines. Medical workers, hungry, overworked, and at times under military attack, try to triage and attend to the many victims of attacks, while also addressing increasing cases of waterborne and other communicable diseases. Israeli authorities' military offensive has led to the forced displacement of over 90% of the population of Gaza, 1.9 million Palestinians, often multiple times, amounting to war crimes and crimes against humanity. As a result, it is usually impossible to inform women of where they can safely access health services and hard for women to reach the few services that are available. The constant displacement of the population as so-called safe areas change, and because of frequent Israeli military evacuation orders, has made it nearly impossible for community networks to establish themselves and for healthcare workers and volunteers to track individual pregnancies or families' needs. Consequently, women and newborns rarely have access to follow-up and postnatal health care. There is little information available on the survival rate of newborns or the number of women experiencing severe morbidities or dying during pregnancy while giving birth or postpartum. However, in July, maternal health experts reported that the rate of miscarriage in Gaza had increased by up to 300% since October 7, 2023. From March to April 2024, UN Women surveyed 305 women across Gaza's 5 governorates, or regions, including 37 pregnant women. 1. Of these pregnant women, 68% had experienced medical complications. Of the 68%, 92% reported urinary tract infections, UTIs, 76% anemia, 44% hypertensive disorders, and 28% preterm labor. Other concerns included bleeding, 20%, hemorrhage, 16%, and stillbirth, 12%. Before October 2023, the rates of such medical complications were considerably lower. Israel's blockade of Gaza in violation of international humanitarian law and the use of starvation as a method of warfare have caused acute food insecurity for most people living in Gaza. As of October 17, 2024, nearly 133,000 people faced catastrophic or famine levels of food insecurity, and 664,000 faced emergency levels of shortages, according to the Integrated Food Security Phase Classification, IPC. The IPC also reported an estimated 60,000 cases of acute malnutrition among children between the ages of 6 and 59 months, and 16,500 cases of pregnant and breastfeeding women who needed treatment for acute malnutrition. The United Nations Population Fund, UNFPA, reported that at the end of December 2024, over 48,000 pregnant women were experiencing emergency and catastrophic food insecurity. In such circumstances, pregnant women in Gaza cannot maintain the good nutrition and healthy diet critical for their own health during pregnancy and postpartum, and for fetal development. Limited access to safe water is a major problem for pregnant women in Gaza. Many have reported dehydration, and some have said they are only able to access highly saline water. Others spoke of being unable to wash themselves throughout their pregnancy. The lack of access to adequate nutrition, water, and sanitation has serious health consequences, particularly for pregnant women and girls and their children. Many health conditions may be caused or significantly worsened by such deprivation, including anemia, eclampsia, hemorrhage, and sepsis, all of which can be fatal without proper medical treatment, which has been very hard to access in some parts of Gaza. Pregnant women in Gaza also described how, like many others in Gaza, their mental health has been under immense strain since the start of the hostilities. Pregnant women in Gaza have very few options to seek better conditions outside Gaza. According to the World Health Organization, of the over 12,000 people in need of medical evacuations, the requests of only 5,383 have been approved and carried out. Since Israel's closure of the Rafah crossing between Gaza and Egypt between May 2024 and January 2025, only 436 patients could medically evacuate from Gaza. Armed conflict between Israel and Hamas and Palestinian armed groups in Gaza is governed by international humanitarian law. As the occupying power in Gaza, Israel is obligated under the Fourth Geneva Convention to ensure that the civilian population gets food, water, and medical supplies to the fullest extent of the means available to it. Israel needs to maintain at a reasonable level the material conditions under which the population of the occupied territory lives. In addition, the Fourth Geneva Convention provides that expectant mothers shall be the object of particular protection and respect. Israel is obligated to allow the free passage of all consignments of medical and hospital stores and of essential foodstuffs, clothing, and medical supplies intended for children under 15, expectant mothers, and maternity cases. Human Rights Watch has found that Israeli forces in Gaza imposed a near-total ban on water, food, and electricity, and used starvation as a method of war, which are war crimes, and committed crimes against humanity by repeated forced transfers of the population. They have also unlawfully obstructed the delivery of humanitarian aid and attacked medical facilities and healthcare personnel. These policies have had a direct effect on women and girls in pregnancy, childbirth, and postpartum. Since October 2023, Israeli authorities have deliberately obstructed Palestinians' access to water. Between October 2023 and July 2024, the more than 2 million Palestinians in Gaza had access to an average of between 2 and 9 liters of water per day, far below the minimum emergency humanitarian standards of 15 liters per capita per day, recommended by the World Health Organization. Israeli authorities have intentionally deprived Palestinian civilians in the Gaza Strip of adequate access to water since October 2023 and are responsible for the crime against humanity.